Welcome to the Healthcare Hustle Podcast, a multimedia project intended to highlight the careers of leaders of color across the healthcare industry. Students, early professionals, and the community at large can expect to gain valuable, unapologetic insight on the career journeys of individuals whose lived experience and personal mission has been centered in advancing health equity. Thanks for listening. What's going on, everyone? Welcome to the Healthcare Hustle Podcast. Today, we are joined by the Association of Asian Healthcare Leaders, a grassroots coalition of Asian American healthcare leaders with the mission to create networking opportunities that increase leadership development and representation of Asian Americans in healthcare management, policy, administration, and consulting. Alyssa, Andrew, Eddie, and Jen, welcome to the show.
Thank you very much.
Oh, thanks for having us.
Yeah, we're excited to be here.
For sure. So it's a big group. So if you all don't mind, and maybe Andrew, just starting with you, can we just introduce ourselves?
Yeah, well, good evening, everyone. For those who are listening, we're recording on evening time. I'm Andrew Nguyen, and I am a second-year administrative fellow with Kaiser Permanente. Grew up in California. My hometown is Roland Heights.
Awesome. Eddie, how about you?
Yeah, happy to see everyone. Eddie Lai. I am the administrator of the Emory Healthcare Innovation Hub in Atlanta, Georgia, originally from South Jersey, right outside Philadelphia. And I've been at Emory since 2019, before I took my new role in 2021.
Awesome. I didn't know you were from the Philly area, man.
Yep.
Missed that one.
I know. We can talk about it.
Yeah, absolutely. Jen, how you doing?
Well, hello, Healthcare Hustle fam. My name is Jennifer Ho. I'm a first-year administrative fellow at Johns Hopkins Medicine. Recently moved to Baltimore, Maryland, which is a lot colder than Houston, where I'm originally from. And speaking of Philly, that's my second home. So we definitely have to talk a little bit about Philly later on if we get a chance. But thanks so much for having us.
Yes, absolutely. Shout out Philly. We won't use any slang on this podcast, though, because we want everyone to understand it. And Alyssa, how are you?
Yeah, I'm great. Thanks so much for having us, Winston. It's great to meet you and Brandon as well. Hi, everyone. My name is Alyssa Na. I am a second-year administrative fellow at Mayo Clinic, working out of Rochester, Minnesota. Originally from Denver, Colorado. Really honestly lived all across the country, though, and I'm now finishing up the fellowship, and so we'll see what happens afterwards.
Awesome. So we just have a fire team, obviously, with us, just exceptional young professionals here. And I guess we should really start with, AL, or the Association of Asian Healthcare Leaders. So maybe you all can speak to just the origins of the group, kind of the thoughts behind it, and we can go from there.
Yeah, awesome. I think Jen would probably be appropriate to start because I think she was the one who reached out to me first.
Yeah, this is a kind of crazy how social media is such a powerful tool. So I randomly messaged Eddie because he popped up on my feed. And from there, we had just an informational call. I was applying to fellowships at that time. And as we were talking, we both had the same story of growing up in a very typical Asian American household, wanting to go the clinical pathway, but then wanting to do healthcare administration instead because the clinical pathway was not really our taste whatsoever. And so from there, we really wanted to open up some type of organization for AAPI individuals in healthcare administration. And so shortly after, Andrew and Alyssa joined the team, and we have over 1,000 members on LinkedIn, right? With our LinkedIn group, we started last year and it's been growing ever since. And it's been such a great opportunity to connect with other AAPI individuals and other allies that may not see an active organization with AAPIs in healthcare admin. So that's pretty much the gist of AL, but feel free to add on to that, Eddie.
Yeah, I mean, on my perspective, was just hanging out in my room, got the message from Jen saying, I think something along the lines of, hey, see you're active in the health administration world, also see that you're Asian. There's not many Asians that are not only active in the health admin world or, pursuing careers there, but also are active on LinkedIn. And I think, from our discussions, we were saying, hey, I've been thinking about how there's just very few Asians in healthcare, in healthcare administration. And I've been part of some groups in the past that, when I joined, I wanted to see more how I can get involved, and just wasn't able to get involved the way I wanted to. And eventually we thought about doing this panel, kind of this origin event was this panel on administrative fellowships. It's around, that season in the summer. And we wanted to see if it was possible with another group. Unfortunately, it just wasn't at the time. But we said, hey, why not just try it ourselves? And I think I had connected with Andrew separately, but it turned out that Jen also knew Andrew. And so when we went up to Andrew to recruit him, he was happy to help and wanted to jump on as well. But I think even I was like taking a look at our numbers earlier. I think we had almost 300 registrants for our first event.
Wow.
And one of the things that we were able to utilize that I think makes us unique is utilize connections on Facebook and other networks that maybe healthcare administration as a whatever you kind of want to call it, a field, doesn't really jump into that much, right? And I think that plus word of mouth plus LinkedIn and our connections all over the country really helped us kind of launch. And I think you could tell that the interest was there after that first launch, because we've had a lot of repeat members, and people have been telling others about us as well.
Yeah, and I just wanted to add, Eddie, such a crazy story that I always love to talk about in terms of Andrew and how I met Andrew. So I also did the same thing with Eddie, with Andrew, just messaging him on LinkedIn, had an informational call, of course, was looking to apply to fellowships. So I just wanted to talk to different fellows or former fellows. And the day that I got off the phone with Andrew, I was just scrolling on Insta, typical IG, and I see a picture of one of my second cousins, and I think Andrew was in the picture. And so I reach out to him and I go, "Is this you in the picture? Because this is my cousin. This is my, family member, right?" And he goes, "That's my cousin." So it turns out that, we're connected on different sides of the family. So we're basically family, but it's just so crazy. And this also just confirms how small the world is.
That is amazing. Just yeah, that's crazy. I think, oh wow, that's yeah, spooky, almost giving me chills. And it's funny because like I feel like utilizing LinkedIn and leveraging it just to make connections sometimes like is a missed skill for many folks. And it's just nice to know that something as big as Al like started from a very organic, point of you just reaching out just about fellowships in general. And so I kind of want to pivot into the first question because I think it's a good segue. And this is, why is your racial or ethnic identity important to you in terms of your role as a healthcare administrator? And I just want to add on a little bit to that because I know specifically when we, reference the Asian American Pacific Islander community in medicine, oftentimes we will not, count or categorize those folks on the clinical side as people of color or minorities because they are so overrepresented. That's definitely the exact opposite on the administrative side. And it's not something we, typically think about. So why is your identity important to you or significant to you when you are performing your role as a healthcare administrator?
Yeah, I'll take a stab at this one, Winston. I think you raise a great point that Asian Americans as a whole are over-indexed on the clinical side and under-indexed when it comes to management and administration. I know a lot of times Asian Americans who are part of subgroups or who are, don't like being categorized as a monolith might feel underrepresented on both sides of the equation, not just on the administrative side, but also on the clinical side. And for me, being Vietnamese, my grandparents didn't have access to healthcare when I was growing up, and my dad had cancer when I was in college. And I always wondered, there's so many Asian people in medicine. Why do we not have access? Why don't we have a lot of representation in the patient experience? And my experiences as a patient, as a family member, really inspired a lot of my research on Vietnamese Americans' access to care. And from there, I learned that Vietnamese Americans had some of the lowest access to healthcare of all Asian American subgroups. And this wasn't something I knew it wasn't something I knew before my research, and it wouldn't be something I would have dove into if it wasn't from this community. So because of that, it really gave me some sense of purpose and something to aspire for, and some motivation to be more involved in healthcare and healthcare administration. And I don't think I would have had that drive or that inspiration without knowing that insight. So I think having a background as someone who is Asian American and someone that's specifically Vietnamese American gave me more specific purpose and something to target in terms of impact I wanted to make in healthcare as a whole.
Wow.
Yeah, if it's okay, I'm gonna go ahead and jump in. Andrew, you bring up a good point about, this idea of subgroups, and I think it's so easy for the larger community to forget how large the AAPI group is. AAPI folks represent more than what it's like 50 countries in Asia, Southeast Asia, and the subcontinent of India. And so, I mean, that alone is a huge diversity in thought and culture and experiences. And when you combine all of that just to, in the Asian category, you really lose a lot of that essence that is captured in those different subgroups. And I think about this article that I saw over the summer. I sent it to our, we've got an all group chat, but I sent it there, and it was an article published by, I think it was CNBC. Basically, it was basically talking about the discrepancy in the large number of Asian Americans that go on to pursue higher education. So we've kind of talked about this, right? There is a large representation of us in a clinical context, and certainly a large representation of us in higher education. But there is that discrepancy when you do look into executive leadership. And of course, that's a little bit more exaggerated in healthcare executive leadership. And so while 60% of Asian Americans go to college and comprise of, I think it's like 12 to 13% of working professionals, only 6% of us actually are represented in that executive leadership. And so why does this matter? I think this goes back to those subgroups, right? There are so many of us that come from all walks of life. And me personally, right? I'm half Chinese, half Cambodian, also American. And so I have all these different identities. And specifically for my community, only 4% of us have postgraduate degrees, both US and foreign born. And so in the context of healthcare, for me personally, that means that, yeah, simply put, I don't see folks like me in these positions that, I'm hoping to pursue at some point in time in my career. And for me personally, that means, either sometimes I question what I'm doing, because I don't see like a role model, someone that I can look after, some shoes that I'll, eventually have to fill, because they're just not there. And so oftentimes I have these internal struggles and dialogue about like how much effort I need to put in to actually get my foot in the door. What is it going to take for me to actually get a seat at that table? And so that's why representation matters. It's still, you can have these open dialogues instead of having these internal, conflicts and reflections with yourself. But
Yeah, I think just adding on to that, for me, growing up, child of two Chinese immigrants, came here in the 90s. I think a lot of the pathways that I was told was kind of what a lot of people considered the safe routes, which for good reason, lead into good careers, such as medicine, engineering, maybe a little bit of lawyering, maybe a little bit of business. But growing up, kind of thought I was going to be a doctor. I think a lot of people in health administration think that that's kind of the path, but they realize, their skills are suited for elsewhere, or they enjoy something else more, but still want to help people through that healthcare realm. And I think not being able to see someone, again, like Alyssa and Andrew said, that looked like me or had my similar cultural background in a leadership role or in a prominent role in healthcare on the administration side, definitely had me kind of searching for, is this something I actually want to do? And when I first met someone who actually, I got my master in public health, had an MPH, and was Asian and Asian American, I kind of latched on. I was like, please tell me about like how you got here. I have no idea, how to pursue this. And, that is one of the reasons why we've made OWL, to be able to be, at least to me, I would love to be that person that I wish I had when I was, in college or in high school or in, even in early graduate school. I do think one thing that Alyssa brought up is kind of in terms of identity. I'm not from China. My parents are from China. I'm American. I was born here, but at the same time, sometimes I feel like I'm not American in some aspects because I might not look like what you would think some people think an American looks like, right? And I think kind of that's the dissonance or kind of thing to navigate towards, where I can kind of marry both the experience, but obviously I'm not fully Chinese, but I'm not fully kind of lived the stereotypical American experience, although you can argue that there's no stereotypical American experience. But I think that that's something that even in the workplace, I've learned to, we throw around the term code switch, kind of navigate between what I'm used to communicating or how I'm used to communicating with, let's say elders in the Chinese in the kind of Asian community versus in the workplace, right, where you're kind of told more to be brash and open or confident in some aspects. So I think like being aware of how that shapes me in my background, but also being aware of and being proud of who I am and being able to speak to my skills in the workplace definitely is kind of how I see that.
Wow. Y'all all came with the heat. I mean, both kind of just the personal, story and the connection, but then also the statistics, right? To make it really relevant and in our face. And, and I have to say, when I first saw Al on LinkedIn, I was like, ooh, this is bold. Like, I love it. Like, what is this? Like, let's go. We need this. Just because again, like I'm all about these conversations. And I remember obviously last year, 2020, and even going into 2021, really calamitous for the Asian American Pacific Islander community. And so, what has it been like speaking up, speaking out, being, that vocal person where there may have never been before in any space? How do you all deal with that pressure?
Yeah, I think that's a good question because even with LinkedIn, there's just so many people on the platform. And even if you don't have many connections, there's so many people that may see your post. But I think at the end of the day, it's really just reminding yourself of your authentic story. And each of us, myself, Andrew, Eddie, and Alyssa, we all share such a common story with being an Asian American. And I believe our stories should be heard because with many AAPIs in healthcare, you really do see a lot of us on the clinical side, like you mentioned, Winston. But now that we are shifting our focus to healthcare administration, healthcare policy, consulting, et cetera, I think there's many other conversations that we can have with this next generation of incoming leaders. And that's why specifically with Al, we're targeting specifically high school students and university students. And we found that our biggest audience actually is within Facebook, which is kind of crazy to think so. So there are numerous Facebook groups that you can join, such as different Asian memes and etc. But these are actually ways that you can network with other like-minded AAPI healthcare professionals or even other business professionals. And so I think we really had to think of Al completely separate from any other organization and be unique to what suits our audience. And I think this really brings back to other organizations that we've all worked with, such as NACI, shout out NACI St. Louis,
Yes.
and then also NALI. Both of these organizations have really been trailblazers and increasing diversity, equity, and inclusion within healthcare administration. And I think that's certainly what Al would love to do. I know personally speaking, NACI, I would not be here without NACI whatsoever. And so whenever you're thinking about speaking up and speaking out, think about other individuals within healthcare that may not be an AAPI individual and see what they had to do, especially within NACI, and see how far NALI and NACI and all these other organizations have grown by telling their story. So I think personally with me, that's how I deal with the pressure of being afraid to speak up.
Yeah.
And
Go ahead.
Eddie.
Okay, yeah, I'll go on and pass it to Andrew. I think, so for me, a lot of my friends are outside of healthcare. They just know me as the healthcare guy doing the Asian stuff. But it is interesting to your point. This past year, one of my good friends, he works in technology and consulting, and he said, your organization is on kind of the biggest news platform in the sense of like the biggest topics in the news these days, healthcare with COVID-19, and the AAPI kind of on the forefront of the violence that has come as a result of different attitudes around AAPI. I'll speak to one example that it's one of those things. At least for me, I live in Atlanta, Georgia. I work there. Metro Atlanta is a lot different than what you might. I'm sure Brandon and Winston, you both know, is a lot different than the rest of parts of Georgia and other parts in the southeast of the country. But I was helping out in our vaccine clinic, working 6 a.m. to 9 p.m. every day for a couple of months, and I was sitting there one day and this person came up to me, and you know, they might just be well-intentioned or whatever, but I think they had come up to the desk that they weren't talking to me directly. And they said, "Hey, is this where I can get the, you know, the passport against the China virus?" And I was like, "Man, like I'm right here. You know, I'm busting my butt to help you out." And it took all, I had to kind of step away because I was like, I'm working so hard to try to help you and like help your family and help, you know, your community be able to be safe from this virus. Like, and then, you know, that person didn't even acknowledge me. I didn't say that to their face, but it's more just, you know, that dichotomy again of being there, but also being there for the solution, but also some people might look at me and blame me for, you know, the cause, right? Even though, of course, like none of us here had anything to do with it. Um, and so I think to your point, um, being able to wrestle with that, especially being in Atlanta, as you know, you might have heard on the news, the spa shootings were in and around the Atlanta
Absolutely.
metro. And to your point of kind of how I reacted to it and how I, you know, within the workplace or in general, I think I'd emailed someone from one of our hospitals, one of the HR people. I said, "Hey, are you guys gonna make a statement about this?" And I was trying to navigate that, you know, not being too pushy, but still, I think like it was important because I think especially in some parts of Atlanta, there are some large AAPI communities, and especially some of the people who were killed were from those communities, right? And so I was really pleased to see the next day that, you know, Emory Healthcare, and I think the university as well, sent out a email saying, you know, if you were in support of AAPI individuals. That was the first time I think I have ever seen anything on AAPI, at least at my time at Emory. Of course, you know, small sample size, but and I think being able to say that and being able to, I think, bring awareness to our executives. You know, I always share that I help lead Al, and they always ask me, you know, what is that? Like, why'd you start that? And I told them, like, honestly, I just don't see many Asians, you know, in the C-suite or like in our leadership here. And I think like they recognize that. We just hired a chief diversity inclusion officer at Emory Healthcare, but I think being able to speak to that, but while also being able to not just be a token Asian or like the Asian person, but being able to do my work well and you know, perform well, and through that be able to communicate better to the people that are around me, so I can hopefully influence some folks or be able to have them hear our stories.
Yeah, and I think Eddie said really well that our stories we think are important, and we also think it's really important to learn from others and their stories. I wouldn't say that there's any pressure. We haven't been distracted by pressure because we've been filled with so much love from our community, from other communities. Like Jen said, we learned from Nali and Nasi, and it's been really humbling to learn from how they've blazed a trail and how they built a group. And we don't get paid, so there's also no pressure there. This isn't a job for us. This is something we're doing because we're really passionate about it, and all of our growth here is organic. So no pressure from what I've seen. I think just it's been so fun and so exciting to meet different people who have a similar mission, like the Healthcare Hustle podcast. It's fun meeting other executives, entrepreneurs, you know, investors, different types of people from all walks of life that are really invested, maybe not monetarily because we're still not in that process yet, but you know, invested in other ways of supporting Al and supporting the mission for broadening representation and also equity in terms of like outcomes in healthcare. So we really learned a lot. I don't think there's been that much pressure, but it's been a lot of fun over the past year and a half.
Yeah. Thank you both for sharing. And Eddie, thank you really for kind of opening up the conversation just even a little bit more, so we can kind of get into the nitty gritty, because definitely there's been so much just terrible things, honestly, that have happened in the last 2 years. You know, almost you forget, unfortunately, a lot of the tragedies, and the spa shootings were definitely something that just shook, you know, my world and many people in my interpersonal circle. And you know, to be quite candid with you all, I was actually quite disappointed overall, I think, with the response and the reaction internally. And I think there's just so many nuanced things within the Asian American and Pacific Islander community that you all spoke to anyway. So you know, it may just be hard for people outside or don't necessarily have this lens to even be able to digest certain things. But I kind of want to talk, you know, more specifically about what it's like being an Asian American fellow, right? because I think, for me, as a minority, quote unquote, or as a Black or African American fellow, starting my journey was really challenging, because I had this huge chip on my shoulder, and there was a pressure almost to stay away from diversity, equity, inclusion work when I first started my fellowship, actually, and I was getting some of this feedback from executives who looked like me, telling me like, hey, that may not, be the space, and you don't want to be, tokenized. You don't want to be put into that position. And I've had opportunities to connect with other individuals in particular, who would categorize or identify as Asian American or Pacific Islander, and talk to them about their fellowship experience. And one concept that maybe doesn't necessarily apply for my personal experience, but I can imagine would put individuals in a tough spot, is the model minority myth, which is something that I, wasn't as familiar again. And so I started talking to some of my own colleagues. And so I would be curious if you all had any kind of experiences with that, or just if you can kind of talk about, some of the things that you started to notice as you were kind of, carrying and embracing your identity on your fellowship journey.
No, that's such a good question, Winston, because I think the model minority myth has always been a topic of discussion similar to the bamboo ceiling. And so I think breaking down the model minority myth, it can just date back to whenever we were kids. I am not good at math whatsoever. And so growing up, I would always get so many comments, why aren't you good at math? You're Asian. So that's a microaggression that is pointed towards a model minority myth that all Asians are smart, that they have access to healthcare, that they have financial and health literacy, which is not the point at all whenever it comes to healthcare administration and trying to think about the social determinants of health. And so we actually had a webinar with three lovely women who are executives right now, who are AAPI, and with model minority myth. I think at times you zone out to reality of what it is at times. And so whenever you're at work, you try to work your best and whatnot. And I think whenever the pandemic really was at its peak with Asian American hate, I think that's when we really dialed it down and talked about these important discussions such as model minority myth and bamboo ceiling. And so I think what we can really go from here is really just having important conversations with not only people that look like us, but allies, to make them aware of certain trends and certain microaggressions that you may not realize. And so I think from here, that's when we can really progress with AAPIs in healthcare admin.
Lisa's jumping back in. Lisa, we were just talking about the model minority myth, but I'll just piggyback off of Jen. Yeah, I think there are a lot of stereotypes from media or from whatever people's perceptions that they have around Asian Americans. I'll speak to, if you guys watched the movie The Big Short, about the Wall Street kind of collapse. There was one scene in particular where I think they were doing something like a Jenga analogy, and they said, "Hey, this Asian guy's my quant, like he's Asian, like," and I think I'm okay at math, but besides the point, I think that with the cultural background and some of the things, people might think that, and I think I honestly, growing up, thought sometimes I had to kind of fit in this thing where I, gotta be smart, gotta be top of my grades, but in that kind of didn't allow me to be open-minded on pursuing other careers like I am now, right? And wasn't able to see as many examples of people, just because there weren't so many in some of these more entrepreneurial roles, or these kind of more business leader thought type roles. But I think, with the model minority, what hopefully shows that, there are TV shows now, there are movies that are showing that, Asians are not a monolith, right? Just because you're categorized as Asian doesn't mean this, that, or the other. There's important cultural context that you're bringing, but we're not all the same. And I think people are slowly starting to realize that. And even in the workplace, I think people realize that, yeah, you might look like someone else that someone else might know, but you guys completely different, and have different skills, and that can be always complemented with others that are around you.
Yeah, absolutely. Thank you all, both of you, for the responses. I want to pivot, and I know, Brandon, I'm not going to steal your question, so I'm going to just set this up, because this was actually something that happened to me when I was an intern, before I started my fellowship. And it's just a brief anecdote, and it was something that really stuck out to me, and it kind of aligns with Andrew, something that you had mentioned earlier about just not even knowing the nuances of specific groups, in what they need in terms of services. So I remember I was at this organization, in this nursing meeting, and one of the nursing leaders was talking to another nurse about the need for more translators and more interpreters, because where I was, the organization, that particular region just had a large, or relatively large, influx of Japanese Americans, or folks migrating from Japan, excuse me. And one of the nurses was like, hey, I have had a really hard time dealing with a few of these families, because, we're having a hard time explaining diabetes, and we don't have any, interpreters or translators for Japanese. And one of the head nurses was like, Japanese people get diabetes? And my jaw just dropped. I was just like, was that just said in this meeting? And everyone kind of brushed it aside, like, and I was just like, what? And so, Brandon, I think you have, kind of a question kind of around that, like, for the Asian American Pacific Islander community, what are the kind of services or things that we see, the critical needs? I know this is a broad question that we're asking, but I don't know if you want to have any more insider context, Brandon, but just wanted to kind of set that up for the group.
Yeah, absolutely. First, Brandon Oluyede, Executive Management Fellow at Washington University. Similar to Winston, I was really excited around this idea behind OWL, it's kind of talking about, what Winston was touching on, and a little bit what Eddie and Andrew was touching on, just the specific challenges around COVID and the climate, I guess, in the nation around maybe anti-Asian xenophobia, and not even on that end of the spectrum, but also being on the front lines. A lot of the times you'll see AAPI individuals who are on the front lines in regards to healthcare, and they're, I guess, disproportionately affected by COVID. And I think one of the things I'd want to touch on, if you guys have the chance, just talk about the barriers, the challenges specific to healthcare leadership in regards to the AAPI community, and the resources provided by your organizations to address those issues, those barriers on your behalf. If there is a lack maybe thereof, that maybe we could touch on that as well.
Yeah, I can. Go ahead, Lisa.
Sure.
I feel like I'm interrupting everybody today.
Thanks, Andrew. I feel like this is where public health really comes into play in medical anthropology, right? So there's this whole idea of going into communities and serving them and providing these different services. But I think oftentimes what gets left out of that discussion is this idea of becoming a part of the community before you actually serve them. Because in order to actually serve them, you need to understand the people you are serving. And the only way you can do that is to actually become a part of them. And so my background's in public health, and it's been interesting, especially because of COVID. I mean, this is certainly a silver lining, but being able to better understand where exactly public health fits in and what exactly public health can add in terms of value to the field of health administration. I think in thinking about Mayo Clinic specifically, this is certainly something that is, an active discussion. And quite frankly, we are certainly not experts in this. And, we've got campuses all throughout the country: Rochester, Minnesota, Phoenix, Arizona, Scottsdale, Arizona, as well as Jacksonville, and all throughout our health system. And that's, very diverse demographics at each of those different sites. And so we're still trying to understand that. And I think, Mayo is the #1 hospital in the nation. And so it is kind of in their nature to want to go into these communities and provide excellent service, right? That's our mission. That's part of our vision and our values. But now, like a lot of other organizations, we are having these very public discussions and dialogue about what it actually means to provide value to a community. Let's not even talk about service, but value. what does value look like? Sure, maybe that looks like service, but maybe it's, creating like professional development opportunities. Maybe it's just going in and having a conversation with them. But really, I think what it comes down to is bringing those people in and having those meaningful, personal, maybe even face-to-face interactions. Obviously, that's quite difficult with COVID right now and the rise of the variant, but making a deliberate effort to actually put your face out there and not, just throwing your name, throwing your brand on certain things, saying, hey, we're this organization that's going to come on this date to provide free testing. Like, that's not personable at all, right? And so if you, kind of tailor the approach to kind of exhibit some of these other methodologies from public health, from medical anthropology, I think you have a much better way, and you're certainly more efficient and effective in reaching these populations that you do effectively and ultimately want to serve.
And I think Alyssa raises an excellent point about the community. Something else that's important about connecting with the community is having the conversations with the community, especially about the diversity and demographic that each community is made up of. And that's something that I'm really grateful that Kaiser Permanente does on a consistent and deliberate basis. I chose KP because I was really inspired by Bernard Tyson, the late CEO, who was Black and had, really concerted focus on gun control, things within the community, healthcare disparities for members of ethnic minorities. And it really shows in our commitment to some of the people and personnel that we've hired. 67% of our workforce is of ethnic minorities. We've invested over $100 million in reducing systemic barriers. And we've been, I want to say, on Diversity Inc.'s top 50 diverse companies for 15 years. So it's something that isn't just a one and done deal, but something that needs to be measured in order to be managed. And having these conversations allow us to develop more specific metrics, allow us to have more insights that represent the people in those communities that Alyssa mentioned, and come closer to more inclusive solutions that allow everyone to have an opportunity to achieve equitable health outcomes. So I think it really starts with engaging the community by having those quality conversations like we are having today.
Yeah, kudos to Kaiser. I've heard great things about not only the internal workforce and diversity inclusion there, but also kind of the way they approach the communities that they serve, right? The diverse communities. And I do think, functionally speaking, Kaiser also being integrated with their insurance and the providers and now education with the new school, that definitely helps when you think about how to integrate all the different seemingly incongruent pieces of healthcare that we all interact with, right? I think to Brandon's second point on how do we see some of the factors that are barriers to seeing AAPI and leadership, to speaking to Andrew and Alyssa's point, I have my MPH. I could talk about public health and social determinants and some of the cultural stuff all day, but I think specifically to that second point, there was a paper, I think, I've referenced it in a presentation I had at Emory for AAPI month in May, from maybe 2004, where NACI, NALI, ACHE, and at the time there was a group called ACLA, which is a former Asian American group that had started, in the early 2000s, I believe, or somewhere around then. They did some research and they did a lot of components on kind of what your first job in healthcare was, what your undergrad was, what you studied, and one of the things was like a lot of API people kind of studied things that weren't, didn't really study business or whatever. And so I think going to Jen's earlier point, I think, exposure, education, that this is a viable path. I've been meaning to speak back to my old high school, the pre-med club, to say, hey, I was pre-med at one point, or I was pre-PA at one point, but this is still a path you can go, that you can still help people and still make an impact in the healthcare realm more in general. So I think just adding on to that, education's both for the communities, the families that are raising these children, or also people who are thinking about this but don't have a good role model.
And Winston, I'm reminded of our initial call, actually, where you talk about pipeline versus pathway. And just thinking about Al, we're really trying to build that pathway, because as you mentioned before, you can build a pipeline, but if you can't build a pathway to the pipeline, there there's no difference in even building a pipeline to begin with. So I think what's really unique about AL is that the pipeline is already in place with many numerous organizations such as Kaiser Permanente, as Andrew mentioned, Johns Hopkins Medicine, et cetera. But now it's time to really focus on the pathway. And as Eddie mentioned, with starting in high school, what's so unique about AAPI individuals is that we have to start at such a young age now to really expand their knowledge of healthcare administration. It's not enough to target students that are already in graduate school. We've found that although we have learned so much from ACHG, NACI, and NALI, our audience is completely different, and we have to make sure that we're targeting them at an age where we can actually evoke change and really show that they can choose a different pathway from a clinical route. And from there, then they can go to college, grad school, et cetera. So I think really differentiating between pipeline and pathway, that's been such an important aspect of AL.
Yeah, and I'd be remiss if, we didn't talk about the first podcast of Healthcare Hustle, because I remember there's a quote that resonated with me about how knowledge at times is more important than experience. And to, quote Jen about knowledge, what we're trying to do through our experiences is to pass down any knowledge that we have to those who are coming after us. And we're still pretty early in our careers, but we've learned from a lot of executives that have a lot more knowledge than us, and we try to disseminate some of our learnings to those that are interested in the career in healthcare management, whether they're wanting to go into innovation or something more operational. We still want to cater towards them and use those specific channels to share that knowledge, like on Facebook or on LinkedIn or even Ladder. So those are things that we're trying to do to connect with the younger community.
Yeah, no, that's it's awesome. And I think, everything that you all said is super important. And it's cool to be able to be, with you all kind of in this moment. Because, that's essentially what we are trying to do with the Healthcare Hustle podcast as well. There's just so many dope, amazing executives at a certain level. And, it's like, where are you at? And how can we get access to you as young people who are interested in these careers and want to know about this insight? How do we know? And so this is definitely one of the platforms that we want to leverage. And I think, we're coming on time here. And so one of the more boring loaded questions, but I think it will be super relevant, particularly for anybody who is just starting their journey out. And specifically for folks who identify with the Asian American or Pacific Islander community. Do you all have any advice, right, for folks who are just starting out on this journey, young professionals looking to kind of, harness the energy that you all have with embracing your identity, being bold, and just making it a part of the conversation? What is that one, golden nugget or gem that you would want to give to people listening right
now? Join AL. Just kidding. I mean, yes, but no.
Not bad advice.
I think I do think, I honestly do suggest that in terms of being able to get plugged into a community that have people from similar cultural backgrounds, or you might feel more comfortable depending on your background talking to. But I think what I found, and this is cliche, and this could apply to anyone really, is that a lot of the opportunities that I found, including my current role or things I did at Emory, were things that I kind of pursued or kind of took initiative for. And I think that's actually pretty relevant to this conversation, because a lot of Asian Americans, depending on their background, are told kind of not to rock the boat, play it safe, and to do some of the things that you need to do. You gotta take some risks. There's some chances you gotta make that you wouldn't have otherwise if you were to follow kind of the straight path, right? But I would say that what I've learned in my time, both as a student and starting this and doing other things in my career, are that you'll never know unless you try and you ask. And I found that to be generally helpful. And you also, with that, being aware of being pragmatic on what risks come with that too. But I think that for me, it's definitely yielded a lot of good things that happen, including being involved with some of these aspects.
Yeah, I love what Eddie said about rocking the boat. So what I'm about to say next, I guess, might rock the boat a little bit, but I say it specifically in the context of just professional healthcare advice for the AL and Healthcare Hustle listeners. I've always tried to live by the mantra of, don't ask for permission, ask for forgiveness. You'll never be qualified for some of the roles you go for. You'll never have enough experience. We didn't have any experience creating a LinkedIn community, and we didn't ask for any permission. We just did it because we thought there was a change that needed to be done in the world, and we did it. We might not have done it perfectly. We still might not be doing it perfectly. There might be some people we rubbed the wrong way. I hope not, but we might have. But we did it, and we're still doing it. And the Asian American community can be very consensus driven and very respectful. So I think for people who might be raised in that type of environment, it's important to know when to have incremental pivots and know when to adjust when you're trying to achieve some things in your career. So yeah, rock the boat and know when to move quickly and without permission. But I say that strictly in a healthcare context, because that can be misconstrued.
I think the only thing I have to add to all of this is, one thing that I think brings communities together is this concept of storytelling and of certainly family. Obviously, throughout the discussion we've talked about our families and our upbringing all throughout these questions that you posed. And so when it comes time to, start thinking about fellowships and other professional opportunities, there is going to come a moment where you're asked to tell me a little bit about yourself. And to that, I say, don't be afraid to talk about yourself and your upbringing, right? We are the product of all those who came before us. We are experiences, we are struggles, we are accomplishments, we are milestones. We have so much to share, and we have so much value to contribute to whatever industry we choose to pursue. And I feel like a lot of times people are afraid to have those conversations and to talk about how they were raised or what their cultural background is like. But I think there's certainly a beauty in that, and that's what makes you unique as an individual. And so if you're willing to share a little bit about that, I certainly think that's one way to really set yourself apart from others, but also to really have a meaningful impact and lasting impression on someone, because the experiences you have had are not going to be like any of the experiences other folks have had. And because again, that's what makes you you. And of course, I think that these discussions that we're having, they're so intricate and there's so many different layers and dimensions to them that it's really helpful to find a community where you can have these active dialogue and reflection. And so whether it be all or another community that's similar, I certainly think you should find a group and surround yourself with folks who, are thinking the same things and are going through the same things, so you can have that collective experience and, kind of go through all that together.
Definitely, Alyssa. And I think this brings back a point that could be contradicting, because we're talking about being advocates and we're talking about looking at people that are like-minded and that look like you. But I think at the end of the day, comparison really can be the thief of joy. And I'm reminded of a quote that I got from a Nasi Women's Conference, where you're going to miss your exit looking at someone else's lane. And whenever you're going through the administrative fellowship process, going through the job application process, it's important to note that no one can beat you at being you. And so, yes, we're talking about diversity, equity, and inclusion, and being with other leaders that are in high positions that may be AAPI. But at the end of the day, you have your own purpose, you have your own pathway, and you have your own pipeline. So at the end of the day, two things: join Al and listen to the Healthcare Hustle podcast.
Yes, best advice ever. I love it. Okay, thank you all so much for joining the show tonight. Just want to give you all the opportunity to plug Al, so where we could find it online, and just direct any of the audience to join from there.
Yeah. Again, to Jen's point, listen to Healthcare Hustle podcast and join Al. You can find us a couple different ways. Right now, the best way to join our 1,000+ growing community is on LinkedIn. I'm sure that when we kind of post some of the links for this later on the marketing, I'll send the links over to y'all to help out. But that's where we're posting a lot. People are sharing. You can also find the link to join our GroupMe, which is a little bit more intimate conversation where at least for me personally, when I visit different cities, I meet up with some people from Maryland, I post pictures. You can find us on YouTube. We've posted a lot of our resources that are for free there on YouTube. Some of our past panels on internships, fellowships, consulting, etc., on there for people to be able to see and also to spread more of who we are. I'll let everyone else speak to other ways to potentially find us.
You hit it right on the nail, Eddie. And of course, with many other Facebook groups, GroupMe, LinkedIn, we really hope to grow our presence in the university space. So be on the lookout for hopefully some more university chapters. We're in the process of launching a university chapter of AL at Texas A&M University. So I think this will be a good way to really grow that pathway to the pipeline. And from there, we can even think about high schools. But thank you so much, Healthcare Hustle fam, Winston and Brandon, for just being such great people and doing important work with DEI.
Well, that's it for the episode, and we want to thank you for listening to the Healthcare Hustle podcast. Make sure to check us out each month on Spotify and Apple Podcasts and stay up to date with the Healthcare Hustle fam by following our page on LinkedIn. The marathon continues, so keep on hustling.